tonight. Later we're going to have baby food eating contests and who can decor the baby fastest challenge. That's for the dads actually. Now remember, for the kids, we do have that wonderful little activity area over there. We've got some refreshments, so please enjoy that. And don't forget to greet your community healthcare providers over there. We're going to be hearing from some of them in just a little bit. And we've got some fabulous door prizes as well, so make sure you got your ticket for that. So please mingle, enjoy some more music from Trish Wells, and we'll be starting very soon. Thank you.
Social event where we all the staff of the Kingsville hospital that provide baby care, motherhood care as well. We have a very dynamic team. We have two experienced obstetrician gynecologists, Dr. Angelina Chan and our new addition, Dr. Denise Campbell. They're both very experienced and looking forward to continue your care with them, now and in the future. We also have our midwives, Andrea Cassidy and Jody, who providing midwifery care for any patient who requests midwifery care. We also have distinguished experienced nurses in the department. A few of them are here, Erin and Rebecca, our head nurse manager for the department. And we want to again thank you for being here. Thank you for choosing Leamington. And I want to correct a myth that some people may have. We have epidurals in Leamington. 24/7. So whatever policy people have outside the community, we don't have epidurals, it's wrong. We have epidurals. So please spread the word around. I would also like to meet personally, thank every one of you here for letting us, our OB department, nurses and doctors, be part of your family. It's important that you know that we care about you, and the care that you will get in Leamington is going to be number one, exemplary, with empathy. So continue enjoying your meals, continue sharing your social survivings around here, meet people with your friends, and let us know if you have any questions or concerns about here. Oh yes, I'd like to introduce Rebecca, nurse manager, Dr. Angelina Chan, new addition Dr. Denise Campbell, and Jody, our midwife. Andrea is coming soon, and these lovely ladies will provide excellent care that you need in Leamington Hospital. I'd like to ask Rebecca to say a few words. Yeah, your family.
That was wonderful. Thank you, Dr. Sack. And thank you to some of our other sponsors, Oak Farms, as well as Joan Homestead Photography. Right now we're going to hear from Rebecca Ismail. She's a graduate from St. Clair Community College, diploma nursing program, and then furthered her studies, finishing a Bachelor of Science in Nursing at University of Windsor, and then Master of Science in Nursing Health Systems Management at University of Detroit Mercy. She holds a certification in inpatient obstetrical care. Rebecca has held many leadership roles, managing busy labor and delivery units, outpatient OBGYN clinics, both in the U.S. and here in Canada. Currently, she has come back to her hometown and is a program director of maternal newborn services at Leamington District Memorial Hospital and has been with us since October 2010. Rebecca.
Thank you, Carrie, and welcome everyone. Okay, so again, I want to say thank you to this wonderful turnout that we've had this evening. And I'm going to be speaking just a little short presentation here on what our unit is all about. Compassionate nursing care, that is certainly what we deliver at Leamington Hospital. So our nursing team is myself. I've already been introduced. We have, as Dr. Sapka said, 2 nurse midwives on our team, Andrea Cassidy, who just arrived. Hi, Andrea. And our new nurse midwife, Jo Dinair, and we welcome her. We have an all-registered nurse staff within our obstetrical department, 7 full-time staff, 9 part-time staff. And I have some of the nursing team here tonight. Erin, can you wave to everybody? Erin is, has also spent time working in United States at a busy level 3 center and has come to Leamington Hospital. We have Pam. Pam's been with the hospital for a number of years.
When are you going up?
Nora, back here holding one of our babies that delivered with us. Thank you, Nora, for coming and helping. And then we have, I believe, a couple more staff members who are part of the fashion show, so hopefully we can meet them later on in the evening. So I think that's nice to emphasize that it's an all-registered nurse staff, very highly skilled, professionally trained. Just a little bit, when we talk about high reliability organizations, most of them all have a mission, vision, and value statement, each particular unit of that hospital. So the mission of the Department of Obstetrics at Leamington Hospital is to promote the health and well-being of women of childbearing age and their families within our community. Our vision is to provide patient and family with compassionate care and comfort that we would want for our own family members. Our values will deliver that care with respect, compassion, communication, community engagement, and certainly focusing on quality and safety. The way we deliver our care on our unit is a family-centered maternity care model of care. It's a complex, multidimensional, dynamic process of providing safe, skilled, and individualized care to our patients and our families. It responds to your physical, emotional, psychosocial needs of the women as well as the family. I want to emphasize that because the family is very important. The patient is the focus of attention. We want to make sure that our patients and families have informed choice. We want you to have the birth experience that you want. Many ladies come in with birthing plans, and we certainly do honor those birthing plans. And we also have open visitation on our unit. It's important that the family or whoever the mother wants there for her birth is there. And we respect that and we appreciate that. So we look forward to that participation. So what makes us different at a small community-based hospital? We are able to provide one-to-one nursing care for our patients in labor. I think this is really important, just to have that nurse at your side, guiding you, coaching you. Some of our patients may bring in a doula with them as well. And together, as a team, we do provide that care compassionately that you need. We will soon be installing a Whirlpool spa-type tub on the unit, so that that would be a choice for some ladies if you wanted to actually labor in the tub. We don't plan on doing water births, but certainly the spa tub is a nice method of relaxation when you're laboring. We have all kinds of various modes of analgesic relief if you need it. Entonox, that's for just a layman's term, kind of laughing gas, nitrous oxide, that helps take the edge off a little bit. As Dr. Sadka said, there's still that myth out there that Leamington Hospital does not provide an epidural service, and that is so not true. Okay, we have 24/7 epidural service if that's what you want. We have different intravenous and intramuscular medication that we can give you to help you relax in labor, as well as
it's not a good idea to do this.
injections, which is another method of pain relief.
Well, go ahead.
Other labor support items include birthing
Can you go around
balls,
that way?
birthing bars, that are all of our labor beds have its own birthing bar. Certainly we encourage ambulation during early labor, and many of our nurses are also skilled at giving you a nice massage, likewise the midwifery group. And very much do we support breastfeeding, and we encourage that, okay, with our families. We're in the process of working towards baby-friendly initiative. Have you heard of that term before? Baby-friendly is the whole, we know that breastfeeding is best for babies, and there's a lot of good reasons why you should breastfeed. And that's something that you'd want to speak to your midwife or your physician about during your clinic visits with them. So again, what makes us so different? We're a small, community-based hospital caring for low-risk obstetrical patients, which means that they would be 36 weeks, you have to be 36 weeks or greater, okay, to deliver at Leamington Hospital. And our current volume right now is about 300 births per year. Just want to say a few words about patient satisfaction. Our scores are very good when it comes to patient satisfaction. Many of our customers tell us that they would recommend our hospital to others for our birthing services. We receive numerous cards from our patients, pictures of their babies, gifts from some of our patients and families come to the unit, as well as, I think the coolest thing is a lot of our patients bring their newborns back after a month or so just to have a visit with the nursing staff, and the nurses really appreciate that. A little bit about the nursing skill set on the unit. We have many long-term staff members who are committed to the hospital or the unit, both a combination of diploma nurses, those who are Bachelor of Science in Nursing prepared, university prepared, as well as Master's prepared nursing staff. All of our nursing staff are certified in what we call neonatal resuscitation. Okay, it's a requirement to be able to work on the unit. That is a certification where you have to get recertified every 2 years and show that you are able to resuscitate a newborn if we have a birth and there's a problem with the baby. They are also certified in basic cardiac life support. 2 of our nursing staff recently got trained as NRP, Neonatal Resuscitation Program trainers, and they train the rest of our nursing staff, respiratory therapists, physicians, right in the hospital now. A year ago, we used to have to go elsewhere to get that training. Over half of our staff have also been what I call ACORN trained, and that is acute care of the newborn at risk. This is a 2-day program where the nursing staff go to London and they're trained by London Health Sciences Centers on how to stabilize an infant prior to transfer of that baby to a higher level of care. By that I mean, occasionally we do have patients coming in who have gone into preterm labor and they're not 36 weeks yet, and sometimes the birth is inevitable. We have the skill sets that we can manage that baby until the transport team comes in from Windsor. Most of our babies do go to Windsor if they do need to be transported. On our unit, we're called an LDRP unit, where you labor, deliver, recover, and have your postpartum care in the same room. The baby stays in the room with you. We do not have a newborn nursery in Leamington Hospital. Another cool thing that has just happened, and the big banner is behind me, we're committed to a 3-year partnership in the Managing Obstetrical Risk Efficiently, which is called MORE, OB. It's a quality and safety training program that the whole team, our physicians, midwives, nursing staff, it involves the whole hospital, respiratory, anybody that comes in contact with a patient who is pregnant. And this is a 3-year program that we're committed to. It's additional training for nursing. We will be running simulation drills, perfecting our skills when we do have obstetrical emergencies. So what is the future of our unit? Our goal is to double our birth volume over the next 2 years. Well, boy, doesn't that sound like a stretch? So how are we going to do that? This is a good example of how we're going to do that. We're going to market our services and reach out to our catchment area. So our catchment area would be Kingsville, Harrow. We'd like to probably include Essex, Wheatley, going the other way. So we will be having events in the community like this one. So stay tuned. There'll be more to come. Again, how are we going to do it? We just hired a new female obstetrician and gynecologist, Dr. Campo, and hired another nurse midwife. We have recently conducted a focus group where we invited some of our previous ladies who have delivered with us and some who are currently pregnant, and asked them, what is it that you want from the obstetrical services at Leamington Hospital? So we got some really good feedback from that group. And we're also looking at redesigning our physician-provider model of care, making it more of a team approach. And this will certainly help with work-life balance among our providers of obstetrical care.
I recently delivered in Leamington Hospital on January 28th, and I've delivered in other places, and this experience is like no other experience. For me, it was very empowering. I felt like I was delivering at home, but with all the medical necessities handily, and thereby I could something to them, which I did in fact in some of them. So the team was fantastic. Every single nurse was amazing. I had Andrea Cassidy, my midwife was awesome. The care throughout the pregnancy was fabulous. And I hired a doula from the doula collective, and that was one of the best moves that I did for myself and for my labor. I think every woman walks away from her labor and delivery and thinks about it a lot. How could she change things? You know, there's not a whole lot that I would change. It was such a positive experience. And when I became Andrea's client, our midwife, she said, you deliver in Leamington now. And I said, okay, that was a jump for me. And I committed to Leamington Hospital, and I think we need to get the word out there that Leamington is the place to deliver. It gave me the peace of mind that I needed in my delivery. And I encourage you to spread the word and help spread the word that we need to get women to Leamington. It's the type of birth that you want to have. Thank you.
Thank you very much. Shower. As Rebecca said, I'm Jenny Dorowski-Melnick. I'm the volunteer specialist at Leamington, and I also oversee the Inspirations gift shop. Our staff have described our gift shop, and this is a quote from our staff: a fun atmosphere to check out the latest fashions, see what's new, visit with Sybil, and you'll meet Sybil in a bit, and browse the elaborate displays of gift items and jewelry. We specialize in clothing, jewelry, and giftware. We have a baby section, which we'd all like you to know. We have volunteer knitters that knit sweaters, booties, hats, and you'll see that later on in our fashion show. We have twins here tonight that are going to model some of our knitted wear for you. I feel our great success for our gift shop is the support of our staff and patients, and to the never-ending support. We have over 55 volunteers in our gift shop right now. So we're going to start with the fashion show, so please don't be shy. As our models walk by, please feel free to ask questions about the outfits. They'll be wearing jewelry items, clothing, carrying purses, and we are also pleased to offer a 10% discount tonight. So anyone that attended the baby shower tonight, if you come to our gift shop between now and Friday, we will be offering you a 10% discount. So just go to the cash, let the ladies know, our volunteers, that you were here and you'll receive your discount. As is to be attributed to Sybil. So let's welcome Sybil up with her as her. So I think we'll get started. Our first model tonight is Jocelyn Nair. You've already met her tonight. Come on up. She is a midwife and one of our new arrivals at the hospital. She is originally from Toronto and practiced in St. Thomas before coming to LDMH. Before she was a midwife, Jocelyn was in commercial banking, and because of her love for mom and baby, switched her career path.
Jocelyn has a real bright colored sundress on. That dress is $33.95.
Could you go around that way? Sorry, hon. I don't want to get in it. Okay, go ahead. Go ahead. Yeah, go ahead. Go around.
She has a lovely purse for $30. All from the gift shop. Now you pay no tax in the gift shop, ladies. So if you get your 10% this week when you can, you'll also save a 13% tax. Good job.
And I will say, anytime you find any item in our gift shop, 100% of our proceeds go to Leamington Hospital for the purchase of equipment. So that's one thing that we are really proud of ourselves. Any money spent in our shop goes right directly back to our hospital. Thank you, Joffy. And next we have Dr. Angelina Chan. You have already met Angelina. Dr. Chan is one of our OBGYNs who has been at our hospital for approximately 3 years. And she is currently expecting this summer and looks great in one of our outfits, don't you think?
The top that the doctor is wearing is actually $42.95. It's very, very, very fashionable. She's got a nice pair of flats on there. That's in the top. It's got some glitter on it. She's wearing a bracelet. She's wearing a ring. Ask to look at it and she'll show it all to you. She's tiny and she's $50. And a nice zipper bag for food. Makes a nice easy outfit.
Vanessa is one of our newly graduated registered nurse who works on our Renew unit, and she's been with us since September 2012. She's
She's from the LDMH Kingsville area. Vanessa originally began her career in hairdressing, but switched to nursing.